Most people don't realize, but the largest organ in your body is your skin. Without your skin, you actually can't live. And there are some people, unfortunately, who do have serious problems where they lose large areas of their skin and they actually have a very tough time surviving. How do you take care of your skin? It's a good question. It sort of depends upon where you are in your life, for example. Obviously, if you're a little baby and you can't take care of your own skin, you need your parents to make sure that they change your diaper frequently and use moisturizers and keep you from getting an infection or an irritation. As you get older in your teenage years, you need to make sure that you take care of your skin that may be too oily and whatnot. You may be prone to acne, so you need to wash your skin and use appropriate acne medications and things like that if necessary. As you get older, you need to make sure that your skin doesn't get too dry. So you don't want to bathe too many times with harsh soaps and waters, and your skin can get dry and then develop rashes. And then all throughout your life, you want to make sure that you don't get too much sun exposure that can lead to skin cancer and melanoma. As our skin gets older, especially if we've had a lot of sun exposure, our skin loses the elasticity of the skin. It becomes, instead of when you're a little young person, if you pull on somebody's skin, it kind of bounces right back and goes back to normal. As we get older, if you do that, it takes a little bit longer for it to go back, and then as time goes on, you start getting wrinkles and your skin loses a lot of that sort of tensile strength that it once had. A lot of that is normal aging, but if you go out into the sun, it's much more accelerated. The scalp can be the site of a lot of conditions also, and if you've never had any disease in your scalp, you might not think about it. Probably the most important one is what's called alopecia. If you're losing your hair, especially if you're a woman that has got a lot of hair, or even if you're a male that you're going bald, I mean, that's really distressing to a lot of people. In addition to that, there are a lot of inflammatory diseases that can affect the scalp. Folliculitis, psoriasis, seborrheic dermatitis, and then there are some really sort of terrible diseases that sometimes can get into the scalp. There's a thing called dissecting cellulitis, which can cause really large boggy areas of inflammation, and pus can drain out of the scalp. It's almost like severe acne, but it just affects the scalp as well. So if you do have something up there, that's probably a good idea to get checked out by a dermatologist, and they can make a diagnosis for you, and then it can be treated appropriately.